I'm sorry. Hey, good afternoon, everybody. Welcome in to another edition of our Election 2020 mini series here on Don't Call This a Podcast. You'll notice that it looks a little light on the schedule today in terms of faces on the wall looking at you. I want to welcome you again to my closet here. I am Ryan McLaughlin, one of your hosts for our series, for our show. And we're going to do things a little bit different today. If you followed us, if you watched us or listened to us, you know that we typically go through the week and talk about the biggest political news stories of the week and how the election on the national scale is shaping up. But we always talk about how important local elections are. And so today we have the honor of being joined by Dr. Rebecca Mitchell. Dr. Mitchell is the Democratic nominee for the Georgia House of Representatives, District 106. Dr. Mitchell is a Harvard graduate where she earned her bachelor's in biology before attending Cornell University, where she earned both a veterinary degree and a doctorate in epidemiology. She's a public health expert and an expert in epidemiology, as previously mentioned. She spent time at the CDC as a prevention effectiveness fellow, where she reviewed statistical analysis of molecular data, as well as worked in the Division of Domestic HIV and AIDS Prevention. Dr. Mitchell currently serves as a visiting assistant professor at Emory University. And on top of all of that, she's a mother of 4 young children. I'm extremely excited to welcome Dr. Mitchell to the program. How are you doing today?
Good. We just almost had 1 young children. Wow, you did a really thorough job of researching the background there. I usually, I don't run a, politically, I am unaffiliated with Emory, just so everybody knows. But yeah, so I did actually spend some time at CDC. It was both in malaria and in HIV. But yeah, I'm doing okay today. My air conditioning finally turned back on.
Oh, good, good.
It's slowly coming down from 90 degrees in here. How about you?
Good. Yeah, I'm doing great. I'm glad to hear the air conditioner came back on. I was a little worried when you told me a little bit earlier because this is the one day of the last week where it actually got, summertime hot, right?
Yeah, I was sitting here slowly through the day. And I was like, oh gosh, I'm feeling so tired. And I was like, no, it's not just tired. Something's wrong here.
Well, at least you did it. You caught it before you melted. So that's what's important.
Yep.
All right. So, Dr. Mitchell, we of course, some of us in Gwinnett County may know you. Those of us who've been following things a little bit closer. But can you really talk about who you are? You're relatively new to Georgia. You came from upstate New York, correct?
Originally, I came from upstate New York. I'm not that new. So
Okay.
every single child I own has been born in Georgia.
Okay.
So I'm raising 4 Georgians. So I kind of consider myself not that new from that element. But we came down here because the CDC was here. So I was pregnant in 2013 with my first kid, and my husband's actually Icelandic. So we were contemplating. He had a faculty position in Iceland. It looked like I would be able to have one there too. We went to our 20-week ultrasound there and actually got a diagnosis that my son had a major birth defect. And at that point in Iceland, it's a very small country. There's only 300,000 people there. So there aren't a lot of services for unique needs. And so knowing that my son was going to need major facial plastic surgery and potentially would be looking at bone grafts and potentially other associated effects of cleft, we wanted to make sure that we still had access to the American healthcare system if we needed it. And I knew once we left the country, we would never be able to get back in if the ACA didn't hold up because they had pre-existing conditions. It just wasn't going to be economically feasible for us to be able to get back in. So we made the decision to have our son here. And I was very lucky in that I had applied to a postdoctoral position down here in Georgia and was able to take that. And so we ended up in Georgia because that's where the jobs were. And as an epidemiologist, working in Georgia is a great place to be, right? There's lots of scientists here. There's a bunch of research universities. It is a place where if you want to make an impact on healthcare in America, this is a good place to stand.
So, and you have background experience, as we talked about, with the CDC, and you've been able to really utilize or make use of what you've studied or what you spent time in your not just undergraduate but your doctoral experiences for. So it's really refreshing to see when people talk about public health, when people talk about just kind of the importance of healthcare, somebody who actually has the chops to really discuss and kind of dive into or really diagnose. I hate to kind of use puns here, but really diagnose some of the issues. I think that's a leg up that a lot of people don't really have. So in those lines, you kind of mentioned how, or a big piece of your decision making to come here or not to go to Iceland were revolved around the ACA. I kind of want to follow up on that. Is that what sort of prompts your desire to run, or is there something else that says to you, or that makes you say, I want to make change. I want to make this a better place for people in Georgia. What inspires you to run?
Yeah, that's a good question. So I think there's two really personal elements to why I'm running. The 481 was a really big controversy in the last election cycle, and I don't know if you were here in Georgia at that point, but this was a bill that changed our threshold for when you were allowed to have an abortion from 20 weeks to 6 weeks. So as a parent who has had a diagnosis of a birth defect at the 20-week ultrasound, mine was actually 21 weeks and 6 days, you never forget what that feels like. And I knew that nobody should be influencing that decision, because I remember asking, how many days do I have to make a decision? What information do I need to know to be able to make decisions here? And I just cannot imagine having no power to make any decisions there. And that's really not something that the government should have a voice in. That is between you and your doctor. And so I went down I was at work that day, and I said, I have to leave early. I have to go down to legislature. And I went down there and I just held my sign in front of the legislature and it just said, I know why they do 20-week ultrasounds. And someone snarkily walked by me and laughed, and he was 22. And he was like, haha, why would they say that? That doesn't even make sense. And I was like, oh, let me tell you. And so that kid who just thought he would be so smart got an entire story from me about my experience. And you know what? He turned around and said, yeah, that makes sense. And he walked back in that building. And we couldn't do anything, right? We couldn't do anything because we didn't have the votes. And I also ran into Sally Harrell, who is a state senator. And she said, well, we're fighting our hardest. I said, you can fight all you want, but you can't win. She said, I know, but we're coming for their seats. And it struck me, like, I am in the most flippable district in Georgia. So this is the most likely, if we put the effort in, to actually change. And we didn't have anybody on the ballot for the last cycle. And I was standing outside. I could say anything I want. I could do anything I want, and nothing would change it. But being inside, you get the vote, and you get to make that change. So for me, that was really the moment where I came back from that. My boss asked me the next day how it went. And he's like, oh, you should run. And I said, no, I shouldn't run. Then I thought about it, and I realized if we don't get strong candidates in here, we don't change it. And if we don't come with skill sets like statistics, like public health, we can't have those arguments as effectively. So I really thought we need to make sure that this happens, and we need to make sure when it does happen that we bring the technical skill sets among all of our candidates, that we have the ability to fight more battles. So that was really, for me, the moment that made me decide to run. I will say about healthcare, my son had his first surgery at about 5.5 months. I went to our 6-month pediatric check, and they told me I didn't have health insurance. Now, given that we'd moved to a continent to get health insurance, and I know I have health. I know I have health insurance. I know I paid the premium. It doubled when he was born, so I know I paid it. And it turns out what had happened to us is because my husband was foreign, and because his income was in fish coins in Iceland. Literally, they have fish on them. I couldn't prove that we had enough income to support 2 people because I was a contractor. So they had dropped us off the ACA, dropped my son off the ACA plan, and apparently they mailed us something that we hadn't noticed that we'd received. So he really was uninsured. And I was able to fix that because extremely fortuitously, my husband had started a job in the state 2 weeks before. So I could call him. We were still in the 30-day window. I said, we need to be on your health insurance. But I had that opportunity, and most people in that situation don't, right? So there's 500,000 people who will be, when we expand Medicaid, automatically we get 500,000 people more in Georgia insured, but that still leaves about 1 million of us without health insurance. And we can absolutely, expanding Medicaid, top priority. We need to do it immediately. We need to do it before the COVID epidemic started. We really need to do it as soon as we walk in the door in January. But it's not enough, right? We still have 1 million people here who cannot go to the hospital, who worry if I should, if I get this COVID test and then I know I have to go into the hospital, I can't pay for this. And we need to be fighting as a caucus to be trying to design plans that are going to work for more people here.
Yeah, I think that's well said. I hate to involve myself in this, but I use the example of something that recently happened to us. My wife works in insurance, and of course, we work across state lines from where her insurance is based out of. But we had a situation where she had to use an ambulance sort of against her will, and we were slapped with the full charge of over $2,000 because it was out of network. So.
Yeah.
Those are the kind of things that when people talk about not being able to afford healthcare, it's those little things we don't think about, even outside of just having the insurance plan of things that should be common sense that just don't happen. So, all right. Well, moving forward, you've been very involved in public health research. One of the first pillars of your platform, at least what seems to stand out to me, is based around healthcare and healthcare access. We understand why these issues are important to you, but could you talk about behavioral health extensively? That's really at the top of your list, especially with the focus on at-risk communities and veterans. What have you found in your experience makes this issue so important? And do you think it can have a snowball effect on other societal problems?
Yes. So my focus so specifically our platform point was talking about veterans and suicide risk. And that actually is a personal story. The woman who watches my youngest children lost her son to post-military suicide right about a year before she started working for us. And the impact of that on her family will never go away. Never. And we talked about what things we could see change in Georgia that would help that not happen to other families. And this was before I decided to run. And I realized if I'm going to run, I am going to fight to change things for families where I know what that impact looks like. I know that should never happen. That should never happen if there's any way we can stop it. But veterans are also not the only at-risk group where you really see an impact. So as a mom, most of my friend group is other moms. A huge concern among moms in my friend group is those who have LGBT teenagers, right? LGBTQ teenagers. They are at much higher risk. We do not do enough to make sure that we are getting resources to kids who really are going through high school and having different experiences that we really aren't addressing mental health needs. Georgia is not really addressing mental health needs sufficiently in general, right? We don't have enough inpatient beds. We don't have enough child inpatient beds. We don't have enough services. So it's a general problem, and there are specific foci that you see that really are examples from personal life. But overall, we are not addressing mental health here in Georgia in a way that's going to make sure our kids have access to services that they need and that our veterans have access to services that they need. We do have right now a pilot program in Coweta County. I don't know if you've seen this for veteran suicide prevention. We do have a Veterans Resource Center here in Gwinnett, but we don't have enough resources coming to them, right? They really need, I think one thing, especially for veterans, is if you're trying to help veterans, you really need to make sure that what you're doing is supporting other veteran-led efforts, right? I am not a veteran. I do not know what people need. So it's really important that what we do is make sure that those who do know how to help are supported in those efforts.
Gotcha. No, I think those are powerful. Personal stories are always powerful, right? And being able to relay to people that I too have dealt with that pain, or I have known somebody dealt with that pain. It of course helps them to really trust that what they're feeling and dealing with, or at least can be empathetic of what they're dealing with. And I think that's truly important. One of the things that I think has been great for this country over the last few years is the emphasis on mental health, right? We complain about social media a lot and how bad it can be and how negative it can be. But I do think a lot of the focus on mental health and the awareness of mental health issues, primarily through social media outlets, has been very beneficial in moving the conversation forward. So I do thank you for that as somebody who has family members who deal with behavioral health issues. That really means a lot to see those kind of issues on your platform. All right, so let's talk moving forward on your platform. One thing that really interests me is your push for microtransit, especially in Gwinnett County. We know, of course, over the last couple of years that measures to bring MARTA to Gwinnett County were defeated. So I think
we get another shot, friend. We get another shot.
Get another shot. But and I think part of it is actually explaining to people why it's so important. I've had family members in Gwinnett County who turned down the transit because they didn't think beyond the idea of what it's supposed to serve. Yeah. So can you really talk about the importance of having mass transit and microtransit, as you point out, in your platform, and what kind of plans you would put forward?
Yeah, so this one's actually a little complicated when you find out all the moving parts, right? Because we at the state legislature don't get to put the plans forward. What's being put forward actually comes from the county. Some of the funding comes from the state for specific things. And if you look, Sally Harrell this year introduced, I believe it was Sally Harrell, to try to get some of the state funding that's usually DOT to be able to go to public transit. However, there is a plan right now that was put out by Gwinnett County that will be on our November ballots. So initially, the Gwinnett County had submitted 99 projects to the Atlanta Regional Commission for transit. And then they took from those and made a plan for Gwinnett that is going to be on our ballot in November. And that plan, while it is similar in structure to the previous plan, it's really important that people go and look at the details, because several things have been added to that plan that make it more useful to this area of Gwinnett. I mean, in general, Gwinnett absolutely needs transit. We just can't argue against the fact that we need transit, right? If you do not have a car here, it is almost impossible to get where you want to go. However, in this plan, they've done several things that help our area a little bit more. One is that they have sped up the implementation of routes that come down here. So I believe we were in the 10-year window before, and now we're aiming for 5-year window for some of these things. We've also added direct lines from Snellville area up to hubs, and whether those hubs will be up where the new line extension is happening, or the hubs that are currently now on the line coming out from Stone Mountain towards Stone Mountain. But in order for us to be able to attract business here, we have to be able to get employees to businesses, right? I commute on 78 when it's not pandemic times every day. If I leave at the wrong time of day, it's an hour and a half to get to Atlanta. If we can run the BRT alongside that, then we're able to get more people into Atlanta. We have more economic opportunity for this area. And I think that's really essential. The microtransit is a great project. So to give credit where it's due, that actually that did get inspired by my opponent on the general ballot. So they did a trial here in Snellville, and what it ended up being was an app-based service at that point. So you could call the app and they would come pick you up and drop you off wherever you wanted to go in the local area. This means everybody who's here. So we are building quite a large number of 55 and up homes here. When you start building 55 and up homes, what you will have to recognize is that those are people who are not going to consistently be drivers, right? Mm-hmm. So when those people need to go to the doctor, when they need to go to the grocery store, when they need to go anywhere, they are not going to be driving themselves after a certain point. So when we start thinking about long-term sustainability of our community while we're building these homes, we also need to think about transit. And things like microtransit can work really well for those communities. In general, it works also to get other people places, but I think it's really useful when you don't have a super high population density. So if you were to run a bus in a route out here and it was 1 hour that you had to wait for that bus, it would not get as much ridership as a microtransit setup. are still looking to see what the costing would look like, I think, on microtransit on a larger scale.
Mhm.
But they have the data now from the original pilot to be able to know what that's going to look like.
Gotcha. Okay. No, I for one, you giving credit to your opponent, I think that's important, so people know that you wouldn't try and take their ideas as your own. But no, I think that especially when you talk about the retirement age element of things, starting to serve an older population, I think that helps people kind of put into perspective how important that is. So I am glad that you kind of brought those things to attention when talking about microtransit and the importance of it. To kind of move forward, something else that you've been interested in or have pledged a commitment to is an investment in education. Vice President Joe Biden has pledged a commitment to education and has stated, if he's elected, he'll make universal pre-K a priority. And your platform, you seem to be in lockstep, but you take it a bit further when it comes to things like school lunches and teacher pay. Why are these issues important to you? What makes Rebecca Mitchell what puts your heart into the education side, so to speak?
The ocean of children that are not invading this room make me realize how expensive education is. And I specifically want to come back to that pre-K element as well. Mm-hmm. So before the COVID epidemic, it was extremely hard to find affordable daycare here in Georgia. Mm-hmm. Post the COVID epidemic, we've just lost, I believe the estimate is about 30% of daycares here in Georgia will not sustain through this. So when we talk about economic development and empowerment of women and making sure that our workforce can go to work, we're really talking about the impact of losing daycare is much more than pulling those daycare workers themselves out of the workforce. It's pulling families out of the workforce, right? So when we talk about free pre-K, and when we talk about figuring out sustainable ways for early education, so 3K and preschool programs to have more support from the state, we're really investing in our economy and our families as well. Mm-hmm. And I don't want to talk about pre-K or daycare ever without mentioning that we need to talk about salaries mm-hmm. in those institutions as well. So if a pre-K enables one family to be able to go to work and support their family, we need to look at what it does for the workers in those daycares as well. So the average salaries here, I think the estimate I saw, and this may have been several years ago, but a lead teacher was making somewhere between $11 and $12 an hour, and an assistant was making between $8 and $9. That's not enough, right? So as we talk about rebuilding daycare systems here, I want to be really mindful that we need to be also supporting the workers there. And the same thing comes for teacher pay, right? So the teachers did get a raise, not this year, but the previous year. However, I went back and looked and said, well, what does that equate to? How far back do you have to go in time before that's equivalent to the salaries they had before there were decreases? It's actually about 15 years worth of decreases of adjustment. So they haven't really received a raise. They kind of have now made up for 15 years. Mm-hmm. So when we talk about teacher pay, yes, they did we did just see wages go up. We did not see them go up more than to maintain where they are in place. So it's really something we just need to bear in mind. We're asking teachers to do an immense task this year, right? I cannot imagine a class full of 33 kindergartners, even if they were right in front of me and there were no epidemic. Certainly can't imagine 15 of them on Zoom, 15 of them in place, trying to keep them all from not interacting with each other and being the 5-year-olds that they are. So I think teacher pay, I see because I understand what we're asking people to do and that we're not paying them very much to do it. Mm-hmm. As far as children and school lunches, there was a survey in 2017 about barriers to learning, and I believe between 60 and 70% of teachers in Georgia felt that hunger was a barrier to learning for children in their class. Mm-hmm. This is something we can address, right? At a state level, we get daddy, please. Emer? Can you just pick her up, please? Sorry. Sometimes I let her in.
That's all right. I understand.
I don't know what she's wearing, so it's worse than others. Our policies for school lunches are disparate county to county, and even sometimes within a county. We need to have state level policies, and we also need to make sure, so there are federal programs that if you're If your school or your school system fits specific criteria, you can actually get free breakfast and lunch for all children in that school. So it's not reduced price. And reduced price lunches are wonderful. However, just because your family on paper has a certain amount of money does not mean you always have 40 cents to eat that day. So where we have the opportunity, I would love to see the state take a more active role. And there are state inputs now, but if you go through and try to fill them out, they're extremely difficult to figure out for the school system. So I would love to see the state be willing to invest to say, we are going to help every school district evaluate whether they can do this, and we are going to help get that done. Because for every school district where there's free breakfast and lunch without any barriers, without having to figure out which children can get the free breakfast and lunch, we're making sure that these kids are getting food on the table.
Absolutely. I think again that's an important path to go down, especially when we talk about student focus. You mentioned kindergartners and having a group of 5-year-olds and just trying to imagine if you had half of that group who hadn't eaten for the day, can't focus, can't get it together.
Lots of angry little people. Yep.
Yeah, absolutely. So I know how grumpy my 4-year-old gets if she doesn't eat breakfast at the time usually. So, it's just, I think those are definitely important factors. And, a well-educated populace, a state in the country that takes care of their people, reaps the benefits down the road. And we can't be afraid to put the money and invest into people so that little kindergartner can go and get a vocation or go to college or, get into the workforce because they've been able to focus, concentrate, graduate, and do what's necessary. So I thank you for that. I thank you for wanting to focus on even those things that we would see as little things when it comes to education policy. All right, moving forward, let's talk a little bit about criminal justice and justice system reform. You said on your website, and I quote, you would address the lack of post-incarceration assistance and reprioritize investments in Georgia's criminal justice system towards rehabilitation and behavioral health programs. What type of assistance would you propose, and why, again, kind of going back to the behavioral health program side of things, why from an incarceration and prevention standpoint would you focus on behavioral health?
Okay, that's good questions. So I think post-incarceration, there are opportunities to generate programs through two aspects, right? So new programs in the Department of Community Affairs and the Department of Economic Development would both give us opportunities. So we really want to make sure that we are helping pair people that come out with a known skill set to be able to find jobs. And we also want to make sure that we're helping people that are coming out of incarceration to connect with job fairs to make sure that they are getting the opportunities that are there for them. So we've actually spent quite a lot of time looking at data in Georgia, right? So Governor Deal did a big criminal justice reform effort, and they took data and looked at what helped people move away from recidivism. And one of those is actually having the skill set to be able to go out and get a job, right? And you see a lot of programs now where you can actually see the effect of Governor Deal's reforms, part of which was helping make sure that people have skill sets and have education while they are incarcerated, so they come out and they are able to go get the next job. As far as behavioral health, you can actually pull up right now in Georgia, and I did it today, Department of Corrections, and look at what number of inmates in the system are classified as having mental health needs. And that can be people who need daily medication, that can be people who need therapy, that can be people who are dysregulated. And right now there are about 8,000 people in the system that have mental health needs. And if you talk to families of people whose children have, and again, I always end up talking to moms, whose children have been in the system, and this happens to be a mom of, I recently talked to a mom with an adult child who had been in the system, and she said his needs aren't being met, and we are not doing enough to make sure that people's needs can be met, right? Because we're not putting the resources in. And I think it's really important to know when you're talking to state legislature candidates that our biggest opportunities to influence change come two ways. One, we can write legislation that changes current policies, and two, we can influence where money goes in the budget. And when we're putting money in that budget, we need to go look at the line items. And this is something you can do not even as a candidate, but you do this as a person. I've done this as a person go through and see where the money is going. So go to Department of Corrections, see where their money is going. A lot of money going to private prisons. Why don't we use that money better to help the people who are in the state prison and be able to get the resources they need, right? We do not need to be funding the private prison enterprise here in Georgia. We do need to be taking that money and making sure those 8,000 people that are in the system right now are having their needs met.
Absolutely. Okay, so a couple questions sort of wrap this up that don't really dive into policy, but maybe take a look at more of your approach. So you've been endorsed by several very influential women in Georgia's legislature, including Darshan Kendrick, Jen Jordan, and Donna McLeod. How important is it? I'm sorry, McLeod. I'm sorry. You know what? And
she's local. Did you know she's local? Like, she's the next district over.
Yeah. So I know she's local, and I've heard her name several times before, and I still get it wrong. So there's one thing with me. I'm very bad about name pronunciation, simply because I overthink it, like I do everything else in my life. And so, I apologize to Donna there.
She will let you know it's wrong if you ever meet her in person.
And I would appreciate it, and I would take it in stride and be like, you know what, that's fine. I'm an idiot. It's cool. But how important is that to you to have their endorsements? And if elected, how would you look to them for support in terms of getting acclimated to being in that environment?
That's a good question. For me, it was really validating as a person. I think there's something in academia we call the imposter syndrome, where you feel like you don't belong in a room. And I think that is 10 times more powerful for candidates, where you feel like, oh, I shouldn't have done this. I shouldn't raise my hand. I made a bargain with myself when I started this. I was like, the rule is, once you put your hand up, you may not take it down, no matter what happens, no matter what you feel like. And it's really helpful to have other people. So the endorsements tell you that, yeah, they think your hand should be up. And yeah, they think you have something to contribute. So I follow a lot of what these particular legislators do online. I follow them because they're leaders in specific areas. And I also follow them because local legislative power comes as a group, right? We have a Gwinnett caucus. So when you're looking at things we want to do for our local area, it's important that we know what other local legislators are doing as well. But if you want to talk about things like Black economic empowerment, Darshan Kendrick is the person to follow. Not only at the legislative level, but also the information she puts out into the world, things you need to read, things you need to know. If you want to talk about what is technical in the law, so whether or not a bill that's about to be passed is legal or not legal, you go read Jen Jordan's tweets, because boy, if it's not, you will know. And Donna is a champion of voting rights and making sure. So she has registered an enormous amount of voters, and she's really focused on, the census brings us money into our local government, right? The way we apportion federal money is based on the census. So if we get everyone turned out and everyone fills in their census, we make sure that we have more money to work for our citizens. And Donna McLeod is amazing at making sure people understand the impact of decisions like filling out your census and going to vote.
Absolutely. Well, awesome. So I do apologize to Ms. McLeod. I apologize for that.
She won't get you.
So I'm sorry. Just like, don't find me. I'm down the road. Don't find me.
In the closet.
But that would make you new to state politics, and you're well versed. I mean, you know how it functions. Sort of you may not know the ins and outs because you're not in there yet, but you have an idea of how they work. So do you think, in terms of making your voice heard, that it'll be a difficult adjustment? I know you mentioned just trying to kind of do those little promises to yourself and kind of getting over the imposter syndrome, which is very, very real. So I agree with you in that sense, because I have that trouble professionally. And so do you think that there's a way for you to maneuver around it, or do you think that it's just going to take time and you being used to being in there?
I think it depends on what information I'm able to be useful on. So there are a lot of networks already established, right? Freshman legislators coming in don't expect to reinvent the wheel. We find where we fit as cogs. I think the fact that I bring a really unique skill set hopefully makes me useful. And I think the more useful I can be, the more my voice gets heard. And maybe that's kind of the goal of all of us, right? To maximize our utility in getting things done.
Absolutely. Okay. So what are some ways that you want your constituents to to hold you accountable before the election, right? How will you keep us up to date with what you accomplish? How will you demand the accountability? What ways do you think you would engage people in the 106th district?
Well, we are calling everybody we possibly can and saying, hey, we're running. This is what's important to me. What is important to you? So if you get a phone call from me and you have something you're mad about or you have something you're frustrated about, let the people know. So we're getting as many people. It won't always be me on the phone, but some of it is me on the phone. But all the information comes back to us, right? So we really, people can either respond to us or reach out to us. We're on Twitter, we're on Facebook, we're on Instagram. Please don't, if you're gonna Instagram me, do not hit on me. It's 90% of the Instagram people hit on me. I don't understand. And we have a phone number. What is our phone number? Well, my personal cell is 315-729-3983. But if you call it, I recommend texting because if I'm walking around with kids, texting is much faster. And there is a candidate phone number on the Facebook and the Twitter probably as well. But I'm happy to do Zoom meetings. I am happy to talk to HOAs. I'm happy to talk to business organizations. I am happy to talk to community organizations. Whoever wants to, please do reach out, and we're happy to set up a Zoom seminar to just hear from people and let them know where I stand.
Okay.
The best legislative decisions are driven by community need. So somebody saying, this is a need we have right now. This is what we want to see happen. Lets people make legislative changes that are the most useful. So the more feedback we get, the better it is.
Okay. Well, I wanted to pull this up so people could see
it. Website, Rebecca for Georgia. Sorry.
No problem. I wanted to have it up so people can kind of see it and know where to go. RebeccaForGeorgia.com is the website. Also, if you have the opportunity and want to phone bank for Dr. Mitchell, you can do that by going to mobilize.us. You can actually search for this in particular, or I will be happy to put the link or send the link to anybody who wants it. But there are available times over here where you can sign up and help out.
Where is that from? I didn't make that.
Yeah, this is from I want to say not Run for Something. I'm trying to think of the name of the group.
I am Run for Something endorsed, but
So yeah, it's something that's mobilized.
I didn't know that exists.
Yeah, so if you can do so, if you can help out Dr. Mitchell in any way, it would be greatly appreciated. As we've mentioned a number of times before, these elections at the state and national level and local level are very important. And so I'm very, very thankful to have been able to speak with you today, Rebecca.
I had a question for you.
Oh, by all means.
When did you move here?
So we moved back, or I moved back in September of last year. I am a Georgia native. I grew up down the street from where I am now. I currently live off of, well, both times I lived off of 78, but I currently live
78 too. I wonder how close we are. I'm off of Britt.
You said where?
I'm off of Britt.
Not very far at all. I'm off of the hidden part of Cooper. So not Cooper going towards Grayson, but Cooper right before that antique shop. So that's currently where I live now. I grew up across from the Lowe's in 78. I remember that being controversial when they started building it back in the early to mid 90s while I was in elementary school. So, I'm a native. I left back in 2000. I left in 2003. Went to high school in Memphis. Lived in Memphis. Went to Birmingham for college. Lived in Alabama for the last 12 years.
Wow.
Finally came back home.
Pre-hurricane.
Yeah. So
you're gonna vote in the fall, right?
Oh, absolutely. I'll be voting. My precinct is in walking distance. So
I saw you were 156. I only know them by numbers. You're in one of the biggest precincts in the district.
Oh, okay. Well, the line was pretty long during primaries.
Vote early if you can, or vote absentee.
Planning on
a lot
planning?
of drop
Oh,
boxes.
go ahead.
So they had 6 drop boxes for the primary, and I think they're trying to have 15 or 15
Okay.
more. So that'll be much easier.
I'm hoping to board the polls in November. So hopefully that comes to fruition and the application gets approved. But I want to make sure that things go smoothly. I want to make sure that people's voices are heard. It's a scary time. It's that we're dealing with something that none of us really know how to deal with. And then, we could either choose to listen to people like you who are epidemiologists and actually have public health experience, or we can go to YouTube University and try and figure it out ourselves. But what matters is that we listen to the advice that's out there and we try and make things as safe as possible for people. So I'm really thankful for your time today. So is there anything you want to kind of leave for people as far as where to find you? I know you mentioned the phone number and everything before, but I can definitely, what I can definitely do is after you say it on here, I can go back with you after we end this and write it down so that when we put up the audio version, there's links to it in there.
Okay. Yeah. So I think the easiest way, I mean, as you saw, was Facebook off the campaign page, because I check that when people wake me up at 3 a.m. because they need to be in the other bed. So I see that one with the most frequency. But yeah, I'll put my phone number in the chat too.
Okay.
People can give me a call. I think the most important thing to tell voters now is if you're planning to vote in the fall and you want to vote absentee, please request that as soon as possible. You can do that off the Secretary of State website or the county website as well. And the sooner you do that, the better, because that is going to get mailed to you, and then you're going to have to drop it back off or mail it back in. If you're mailing it back in, you really want to make sure you put it in the mail at least 10 days in advance of November 3rd.
Okay. Well, fantastic. I want to thank everybody who tuned in live. We've had a number of people coming in and out, and so thank you for that. Please make sure you register to vote in whatever state you're in. You need to find the guidelines for absentee ballots, find out the final date to request, and then try and submit it as early as possible or find a drop-off center. If you have not yet followed us, make sure you follow us on Twitter at the KWC blog. You can follow us on Facebook at the same address. On Facebook, you just go to the Kids Wear Crowns. On Facebook, make sure you search for Rebecca for Georgia. RebeccaforGeorgia.com is the website. You can find the podcast audio version on Spotify and on Apple.
Spotify.
You said what?
I don't know how to use Spotify.
No. Okay.
I'll never be able to access this.
That's perfectly fine. If you have an iPhone, I can get you the Okay. Well, I'll get you the link, because if you don't have either of those, so I'm glad you mentioned that, you can go directly to our website, thekidswearcrowns.com, and listen to the audio version there, where all you need is an MP3 player on your phone. So, with that being the case,
I'm strong here.
That's all right. I make the joke all the time that I'm probably the least technologically savvy millennial out there. So I'm in my early 30s, but if you throw something at me that I've never seen before, I'm not going to be able to figure it out. I'm just going to have to ask for your help. So I totally get it. Totally understand.
That's why you got the kids.
Exactly. In about 2 years, I'm going to be asking for their help on how to operate their own iPad. So, that's how it works. Rebecca, thank you so much. Really appreciate your time today. Don't go anywhere. I'm going to end the broadcast, but we'll chat off air. Dr. Rebecca Mitchell, everybody, make sure you vote this November. Have a wonderful day. Thank you.